Hello, my name is Gleesina, and I am acting as the clinician who is attempting to explain the impact of trauma to a survivor who has presented to the program for clinical services. For the sake of confidentiality, I will name this person Jess. Jess is a 33-year-old Native American and Asian heterosexual female presenting to treatment for opiate dependency. She discloses a severe history of trauma, significant substance abuse, legal challenges, and multiple psychiatric treatment experiences. She has limited education and employment background. She has very few sober supports and limited contact with her children. In addition, she is involved in a relationship with a male who is socio-economically challenged. Furthermore, Jess' substance abuse began as a teenager in a social setting. These barriers have impacted her ability to remain sober and her instability with her family. She does believe in a higher power and feels that this involvement with her higher power will contribute to her sobriety and motivation towards treatment, and she says that she's receptive to feedback. Her presenting problem is opiate dependency, as she has sought treatment for her use of heroin over the past year, but she has never fully stabilized due to her mental health. She continues to utilize opiate medications despite being in medication assisted treatment. She exhibits impulsive behavior and lack of conflict resolution skills, and she has very few coping skills in terms of sobriety and conflict. Her history includes unresolved sexual and physical abuse and continual involvement with individuals who are substance dependent, and she has lost the custody of her children. Her chief complaint is a long history of substance dependency and poor coping skills. However, she would like to address the trauma that she has experienced while attempting to gain sobriety. And her statement has been that I want to learn and implement skills necessary for me to stay clean and sober while starting a new life and trying to forget the things of my past. In addition, I would like to get my life together for my children. I will present Jess's presenting problems. So, according to Jess's biopsychosocial assessment, Jess presents with 19 years of opiate dependency and a history of cocaine use. She began smoking cigarettes at age 11 and drinking at 12 years of age. She smoked marijuana at 13 years of age and began using cocaine at 14 and using heroin as well at the 14 years of age. She has achieved sobriety at some point in time and became pregnant, which contributed to her 2 years of sobriety. She proved difficult to follow her medication regimen and had recurrent thoughts of suicide, which precipitated her mental health treatment in multiple settings over the past 21 years. So, Jess was a difficult person to follow in that she had presenting factors which challenged her treatment, such as her psychosocial stressors, which were her illicit substance use, her social environment, her barriers and with her history of financial challenges, her relationship issues, her current involvement in a domestic violence relationship. She has medical issues, has many medical diagnosis. She has not completed high school. She has multiple psychiatric diagnoses with the failure to follow medication regimens. So she had her diagnosis include the consistency with depression, bipolar disorder, post-traumatic stress disorder, sedative disorder, opiate dependency, oppositional defiant disorder, and borderline personality disorder. So, she would definitely be someone who would be fit the characteristics of a trauma survivor. I say this because Jess was diagnosed with depression at 14 years old after she attempted suicide. It appears her mental health status of multiple diagnoses, her trauma history, which includes rape by her mother's boyfriend and other unknown individuals, as well as social challenges and a failure to follow the recommendations of her psychiatrist and the medication regimen contribute to her substance abuse. Then recently, she lost the custody of her 2 children and the suppressive memories of the past abuse for her recent relapse. So Jess has knowledge of her problems and has some readiness to change and a history of 6 months or more of abstinence, but she would need to stabilize and understand what trauma is and the effects of trauma in her current situation in order for her to be successful with coping skills and eliminate her cravings to use opioids as a result of her unprocessed trauma. Jess, I would like to take the opportunity to explain trauma to you in traumatic events. Is that okay with you? Understand that traumatic events can be defined as experiences that put persons or someone close to them at risk for harm or death. These type of experiences include road accidents, violence, prolonged abuse, natural disasters, and serious illnesses. So what happens when you experience a traumatic event? You experience a traumatic event to your body's defenses, and they take effect and create some strong stress responses, which may make you feel a variety of physical symptoms and have difficulty, or I should say different experience with intense emotions. This fight or flight response is where your body produces chemicals which will prepare your body for emergency, which can lead to different symptoms, like your blood pressure could be elevated, your heart rate could be increased, you could start sweating, you could reduce some stomach activity, like you will have loss of appetite. Do you understand that? Know that this type of feeling is normal and that your body is evaluating itself and its different ways of responding in an emergency, and it makes it easier for you to fight or just run away. So directly after, this type of event occurs, one may experience shock or denial. And this can go on for over several hours. To a range of other feelings that could come into play while those hours are progressing, such as sadness, anger, and guilt. And many people feel better and they recover gradually after they've experienced a traumatic event. Sometimes these feelings persist for long periods of time and can lead to serious mental health problems such as post-traumatic stress disorder and depression. Jess, are you following me? Do you have any questions for me? Okay, I'm listening. So let me just tell you a little bit about PTSD, or post-traumatic stress disorder. So people experiencing PTSD can feel anxious over several years after trauma, and whether or not they are physically injured, they are mentally experiencing nightmares, flashbacks, they're avoiding places and things that are associated with the event. Sometimes they have panic attacks, they have sleep disturbance, there's poor concentration, and depression is one of the emotional numbing feelings that people that have had a traumatic event experiences. And sometimes they misuse drugs and alcohol, and anger is one of the common symptoms of someone that is a trauma survivor. Are you with me, Jess? So people who have experienced PTSD, Jess, have to see a psychologist or a social worker so they can walk through the most appropriate treatment for them. Sometimes antidepressants are prescribed to help relieve the depression, which a person who has survived trauma often experiences at the same time. Okay? All right, Jess. So Jess, if you want to find out more information about PTSD, I would advise you to schedule an appointment. And this way, you know, you can find treatment options which best suit you. All right, Jess. Thank you.